And welcome back to Can I Have Your Attention, Please? So, this is where I do my weekly podcast by me, Orla Holland, as an adult female with late perimenopause. So, I decided to start this podcast basically to help others, having had such a difficult time myself. First of all, getting the information and then getting the help. And I knew I wasn't alone in going through this. There are hundreds of thousands of you out there, women who have undiagnosed and untreated ADHD, and many of you will be hurtling towards perimenopause and menopause with no idea of what is about to hit. So I'm here to hopefully help, to guide, inform, and inspire you to advocate for yourself so that you can live life to its full potential and live the life and get the help, most importantly, that you deserve to get. So, as always, I do need to state that I am not a healthcare professional. All opinions stated are my own opinions. Any of the facts that I talk about or discuss or quote here on the podcast will all be linked in the show notes, so you can access any of the information, any of the resources that I have used. I've been researching this since April of this year in terms of the ADHD and perimenopause link. With regards to the menopause, I've been researching that for about 3 years. So I have a lot of information. There's a lot of people that I have followed. There's a lot of people that I trust and a lot of resources that I do trust. And they're the only ones that I will ever use and quote when here on this podcast. So today's episode is all about ADHD and the perimenopause and menopause. I have alluded to it in some of my other earlier podcasts, but never really specifically talked about the link and why there is such a link, and also why there's such a lack of information out there about this link and how potentially explosive it can be. So, during this stage of your life, which can actually happen from your 20s, there is no such thing as too early to be menopaused, by the way, but more likely it's going to happen from your 40s onwards. You may find, as I did, that your ADHD symptoms significantly worsen. That's if you are someone who already has an ADHD diagnosis. If you've already undergone your assessment and you know that you have ADHD, you may spot that whatever treatments, whether it be medications or not, that whatever you're using may not actually work as well. It may not be as efficient, I suppose, as it has worked for you in the past. So if you have not yet been diagnosed, which I know many of you out there won't have been, the onset of perimenopause and the hormone changes that come with it may actually be what trigger your ADHD diagnosis, that's how it went for me. Because the worsening symptoms sometimes help you go in that direction. With regards to my own situation, I had been taking HRT for over a year, probably about 14 months, if maybe even 16 months, by the time I realized there must be something else going on. So through all of that, I thought I was just having either a particularly bad menopause, or I kept jumping from one diagnosis to the next. I didn't know what it was. HRT seemed to treat some of the symptoms, but others simply got worse over time. So that's what actually led me to get my diagnosis. I know a lot of other people will say that they got their diagnosis because one of their children, it was flagged to them in the school that one of their children had XYZ, and all of a sudden they were like, oh, hang on, I do. And only then realizing that that was actually as a result of ADHD. So firstly, just to look at the menopause. Now, I'm going to quote from Dr. Louise Newson here. I will be putting a link to her website. Dr. Louise Newson is one of the foremost GPs in the UK. She's a menopause specialist, and I think she is absolutely amazing. She runs Newson Health. She also runs a research centre and charity. Really, her mission is basically to improve the future health of women around the world. Her podcast is absolutely amazing. I was actually introduced to her by Davina McCall. Not personally, obviously, I wish, but through reading different things that Davina had done and watching the program and listening to her podcast, there was one where she interviewed Dr. Louise Newson, and it was the first time that I learned about bioidentical HRT, and the first time I learned about the potentially devastating effects of menopause. This was long before ADHD was even mentioned, but she does have an amazing app called Balance. It's a free app that anyone can download. And again, I'll put a link to it. There's also some great videos and articles on the website that I'll put a link to. So if anyone is interested in finding out a little bit more about that, it is well worth looking at. So, taken from an article by Dr. Louise Newson on the Balance app, the menopause occurs when your ovaries stop producing eggs. So your hormone levels drop and your periods stop. For many, this process happens slowly over months and years as your periods begin to change, a time known as the perimenopause. So the perimenopause often starts in your early to mid 40s, and the average age of the menopause is 51. The perimenopause is when menopausal symptoms occur and periods change either in frequency or nature. The menopause is defined when your periods have stopped for 12 months. After it has been 1 year, you will be considered postmenopausal. So these are the average ages at which these occur, but it can't be predicted. So for some people, it happens much earlier, and others much later. So what does the menopause have to do with my ADHD? Well, this is where it gets very interesting. So during the perimenopause, the hormones estrogen and testosterone reduce. So I know testosterone is always seen as such a male hormone, but actually women produce their own testosterone as well. And during the menopause, just as estrogen declines, so too does testosterone. This decrease in hormone levels can have a significant impact on our health and well-being. Not only do they serve, sexual and reproductive function, but they also contribute towards helping you maintain your bone health, your cardiovascular health, and your brain health. So there is a lot of evidence and research that shows that normal levels of estrogen and testosterone can help thinking skills and maintain your concentration and attention. So low or fluctuating levels of estrogen have been associated with a variety of cognitive issues and neuropsychiatric disorders such as Alzheimer's disease and depression. The role of estrogen is particularly important to consider if you have ADHD symptoms, as it's known to help key neurotransmitters work efficiently, which can be impacted when you have ADHD. So with ADHD, and you'll have heard me talking about this in previous episodes, estrogen can help dopamine, which plays a central role in our executive functioning. So executive functioning is things like planning, organizing, making decisions based on information around us. So it's simply like executive functioning. So dopamine plays a central role in executive functioning. Then acetylcholine helps our memory, and serotonin regulates mood. So estrogen can impact all three of these. And it's known to promote the release of both serotonin and dopamine in the brain. It also helps the production of dopamine and decreases the amount that's broken down in the body. So this is really important, as having ADHD means you really have a dysregulation in your dopamine production, and estrogen can help produce, release, and maintain your dopamine levels. So as you can imagine, as your estrogen levels are dropping and you already have a dysregulation of dopamine, this is going to cause a massive exacerbation in your ADHD symptoms. And again, this can, what I've already said, hit like a train if you have undiagnosed ADHD. So if you're out there and you have no idea, as I did, that I had ADHD, it can really feel like an absolute, life-changing event as this really hits. So with regards to hormones and ADHD, your hormone levels, for all of us, will fluctuate across the course of our life. We know that. In the case of perimenopause, that fluctuation can happen in any given day, in any given hour, as it's sometimes seen. And this makes thinking about the role of hormones and potential exacerbation of ADHD symptoms complicated, to say in the least. So people with ADHD and perimenopause often report that the hormonal fluctuations have a big impact on their ADHD symptoms. And research has explored how during the menstrual cycle, ADHD symptoms can worsen or improve in line with the rise and fall of estrogen. So just as an example, symptoms are reported as being at their best during the follicular phase when estrogen is rising and at their worst during the luteal phase when estrogen falls sharply. This fall is often when premenstrual symptoms. So with your PMS, you can find that your ADHD is an awful lot worse. So fatigue, irritability, and low mood. And actually, there's a disorder, PMDD, that some of you may be familiar with. It's premenstrual dysphoric disorder. It's a severe version of PMS, and it has been found to be more prevalent in women with ADHD than those without. So again, suggesting the emotional changes and cognitive problems that occur as a result of the fluctuating hormone levels have a big impact on ADHD symptoms. So, as we've just talked about there, when you enter your perimenopause, your estrogen levels start to fall rapidly. So, seeing the impact that normal estrogen fluctuations in the menstrual cycle has on your ADHD symptoms helps to explain why you might see a worsening of your existing symptoms when you enter perimenopause, and explain why some women start to have ADHD symptoms that were previously unnoticed. So it can be quite difficult to tell the difference between the two, because when you look at our lives, so, if we take it that most of us are kind of in your early to mid 40s when perimenopause starts to hit, things that you're already feeling, many of us will just simply put it down to aging, and the demands of everyday life, because we're often really, really busy at that time. So you'll often have school going children, whether it's primary or secondary school. Most of us are, full-time working parents. So you have a full-time job going on, and many of us will have aging parents. So I say full-time working parents, that's us. Yeah. So many of us will also have aging parents that may need our help. And, again, will be another demand on us, whether it's emotional or something that we physically need to do ourselves. So there's an awful lot going on. And many of the symptoms that we're experiencing, we can just put down to that, such as tiredness, fatigue, poor sleep, low mood. So actually, if we knew a little bit more about it, I think, and if we talked a little bit more about it and helped each other, that's maybe some of these symptoms could be alleviated by treating what's actually happening, which is the lowering estrogen levels in our body. So just talking about some of the more common symptoms you experience when entering the perimenopause and menopause. So a change in your periods, that's probably one of the ones we know. Changes including the frequency, pattern, or flow. Change in body temperature. So yes, we often hear people talking about the hot flushes, but it's not actually just hot flushes. It's just being warmer all the time. So actually, even sweating more is definitely one of the symptoms of perimenopause. Changes to your mood, that's a definite one. Increased anxiety or increased worry, tiredness and poor sleep, difficulty concentrating and remembering things, commonly referred to as brain fog. And honestly, like brain fog, there's brain fog and there's brain fog. But some of the time, like literally not being able to remember a word, I do wonder and worry sometimes about this podcast, because I have days where honestly just simple words are impossible to access in my brain. It just feels like they're hiding out and they won't come no matter how hard I try. Joint pains and muscle aches, that's a definite one. And often we will focus on and try to treat the very specific things that are going on. Have you ever found yourself going to the doctor with, an issue with your heel, and then a couple of weeks later going with a frozen shoulder, or wondering why your skin is itchy, or why you're having migraines or headaches? And actually, put together, all of these things can simply be as a result of the lowering estrogen levels in our body. So a worsening of migraine and headaches, hair loss, skin dryness, skin itchiness, genital symptoms, including dryness and soreness, urinary symptoms, just needing to wee more often, or leakages, or urinary tract infections, having a lot more urinary tract infections. So they are a list of things that women often go through as the estrogen levels drop in their body. Now, when we look at ADHD symptoms, and here I am going to talk about the fact that some of these may have been at a level that felt quite manageable. So they might have been something they will have been, if it is ADHD, they will have been something that's always been there. But it might have been at such a level that you've been managing and you've adapted to them from a very young age. It's only now that your estrogen levels are dropping. So it's feeling worse. It's like these symptoms are becoming more exaggerated. So looking at the list of symptoms, those that actually, I suppose, that overlap, and there are as many of them, I'm going to call out first, and then I'm going to call out the ones that are unique to either ADHD or unique to menopause. So hopefully this will help you to determine whether for you what you may be going through is simply menopause or simply ADHD, or if in fact you feel it might be both. So starting off with the ones that overlap, sharp fluctuation in neurotransmitters, so chemical brain messengers. That's both ADHD and menopause. So things like we talked about earlier, difficulties in executive functioning and things like brain fog. Trouble with focusing is both ADHD and menopause. A negative self-image, both ADHD and menopause. Fatigue, double whammy in both ADHD and menopause. Forgetfulness, both ADHD and menopause. Anxiety, ticks both boxes, ADHD and menopause. Mood changes, sleep issues, and libido changes. All of these will fall under both ADHD and menopause. The key ones that then actually would only appear in one or the other, so genital and urinary changes would be unique to menopause. Depression is listed here as a symptom that would be unique to menopause. However, I will say it is a very likely comorbidity with ADHD, so that can be a difficult one. Changes to skin, hair, bone strength, and weight management, and the hot flushes or flashes would definitely be unique to menopause. However, impulsivity, hyperfocus, and disorganization would be three that would be unique to ADHD. So I am going to put a link to that page, that table. I find it really, really helpful. I'm going to put a link to it in the show notes so you can have a look at it yourself. One of the most important things and one of the best things you can do for yourself is to track your symptoms. If you can find a way to make that happen, it will help you hugely, especially when going to talk to your GP or your psychiatrist or whoever it is you're going to see, whatever healthcare professional you're going to talk to. That is going to help you enormously. And this table is incredibly helpful with regards to determining which is which and if perhaps it may be both. Now, I am at this point going to talk a little bit about my own situation and the reason that I, excuse me, decided to record about perimenopause or menopause and ADHD this week. So for almost 2 years now, I have been on HRT. I did decide to go down the route of HRT as my symptoms were, well, they definitely outweighed the risk for me in all of the research that I had done. And I only this week started to feel many of those symptoms returning. And when I say many of them, I mean the ones on the menopause side. It took me a week or two to figure out which was which and what was going on. But things like the changes to skin, I noticed that my skin was itchier. I also noticed that my temperature had risen. I was getting hotter again. I noticed that I had pains in my hip and knee. They're the first that kind of come back to me. So they were the things that helped me to think, okay, I think I need to manage my HRT. So I have gone to the place I use is the Menopause Hub. I found them absolutely brilliant, and they are a specialist clinic. And I go to see them as often as I need to go to see them, but I always make sure it's every 6 months. And I went back and I had an interim meeting with the doctor, and we decided to change up my HRT because I had been on the patches, but for the last probably 9 months, it has been a little bit hit and miss in how they are helping with the symptoms. So we've decided to go down the route of the tablet. I will let you know. Hopefully by next week I will know how that goes, because I had not been feeling very well. I had sleep disturbances come back as well, but again, I wasn't sure if that was due to ADHD or the HRT. Because also what happened last week, well, it was actually the previous week it started, was the first time that I got quite badly hit with the ADHD global medication shortage. So every month since I started, I've had to phone a number of pharmacies and find out who has my prescription in terms of who has the dosage that I need. Then once I'd spoken to the pharmacist, found wherever it was that they had it, I would then get straight onto my psychiatrist and ask them to email the prescription to that pharmacy so they could post out my prescription to me. And it's quite stressful every month having to do that. But up until this month, I have been incredibly lucky and always managed to find exactly what I was looking for, or as close as. However, at the beginning of November, was towards the middle of November when my prescription was due, I the basically the level or dosage that I was on was completely gone everywhere. So it wasn't to be found in Ireland. So I had to go to the lower dosage. At first, it was advised that I just wait, and I just have to simply wait. And I rang so many places, and all of them told me the same thing, that there was no date for when they would be returning. So I decided to go on the lower dose. I thought that a dose, just a small amount lower, would be better than none at all. And I'm sure that is definitely the case. However, within a week of taking the lower dose, I started to feel dreadful. And it was really around the mood and the irritability. As I mentioned, the sleep wasn't great. The difficulty in focusing, the forgetfulness, the negativity, the disorganization, and the fatigue all came rushing in on me, and it was absolutely horrible, really, really horrible to try and be a normal wife and mother and worker, and everything else while all of this is going on. And unfortunately, I wasn't able to change my prescription, even though it came back in stock, because it is a controlled substance and there is a shortage. From what I can decipher, it means they can't re-prescribe, a second prescription to the same person within that month. You have to wait till the month runs out. So I simply had to wait. So it was a sharp reminder for me of what we are going through. I think even in the months of having, taken the right medication, and even through the last part of my titration, when I did find the right medication, the relief in that, helped me to forget how difficult this place can be, and how lonely it is, and how very difficult it is to get help. Because while I have a fantastic person looking after me from the HRT and menopause side, and I have an excellent person looking after me from the ADHD side, they are two different people, and only me in the middle can advocate for what it is that I really need. And when you are dealing with something that affects your mood and affects your anxiety and your fatigue and forgetfulness and even trying to remember words, it is very difficult to advocate for yourself when you're in that place. So that was the week that I just had. I'm hoping that next week things will start to improve as I have made some changes. But the overlap in symptoms, you can see how difficult then, and the significant challenges that can pose, in people trying to talk to their GP, first of all, and then even to decipher which is what. So it does feel like you're getting a double helping of some of the symptoms as well. So you do get a double whammy with the fatigue and with many of the other symptoms, as mentioned, and it can make it entirely unmanageable. It can come to a point where you simply can't function. And I know I'm not alone out there. So if you know someone who is potentially going through this or doesn't know what's going on for them, and you think that this may help, please send this to them. Please share this with your, female friends, colleagues, and families. I honestly, anyone over the age of 25, I would be saying, please listen to this, learn what the symptoms are, figure it out for yourself, get the information, educate yourself. Educate equals empowerment with all of this, and it'll help you to seek the right treatment. I guess that's what it's all about. So it's quite difficult to know definitively which is what, but certainly the recommendation from most of the research is that you will need to treat both. And everybody's different, but you will need a tailor-made solution for yourself. And I think that's going to be really, really important to say. When it comes to treatment for ADHD, I talked about that a lot in episode 3. So we talked about the various different types of treatments and medications available. We talked about the pros and cons of medication. But I would be interesting to talk about HRT here. I'm not going to go into a massive amount of detail on it, but what I would like to say is I'd really like people to look into it a little bit more, because the most common thing that I've come across in people who might be anti-taking HRT, it's very personal, and I totally respect that for everybody. All I would say is, please don't take it as a result of fear or fear mongering or as a result of old myths. Don't stop yourself from taking it as a result of that, is how I should put it. Just make sure that you are up to date with the latest research and that it is genuine, and that you question yourself and go, actually, is that true? Have I really looked into that? I think that it's really, really important that you have all of the right information. So HRT simply tops up the hormone levels that are falling when you become perimenopausal or menopausal. So the HRT that you would take, the hormone replacement therapy, that's exactly what it is hormone replacement, is bioidentical hormones. It's plant-based. It's not actually the old HRT that was out many years ago, was pregnant horses' urine, I believe. And there was a study done, I think it was put a link between HRT and breast cancer, and that is completely unfounded and has been proven time and time again to be untrue. But it's always the bad news that spreads and sticks, isn't it, as opposed to the good news. So in fact, an awful lot of the latest research shows that it lowers the risk of heart disease, osteoporosis in the future, and as well as other conditions such as depression, dementia, bowel cancer, and type 2 diabetes. So, we are living an awful lot longer nowadays. And having that lower level of estrogen is still, unfortunately, we haven't prevented that from dropping at an earlier age. But essentially, that's what HRT is helping us to do. It's helping us to be able to, live a more fulfilled and prolonged and happier life by replacing levels of estrogen that are falling within our bodies. So you'll find that, HRT, there's still some myths, I know, that persisting about HRT, and it may result in you not being offered a treatment that could really help also. And I know many of us are still coming across this. You may be told that HRT isn't suitable for you, when in most cases it is. So please, please do the research. It's really, really important that it is okay to ask your GP for HRT if you decide you want to try it. You can point them to the resources and research that helps to explain the important role of hormones in managing both your perimenopause and menopause symptoms and ADHD. So your doctor may not be aware of the link between the female hormones and ADHD symptoms. There's very new research with regards to that. But, the link between the menstrual cycle and ADHD, there's plenty of links out there and information out there. So it's important to remember that all of this has been clearly evidenced and researched, and it's there and available to be used. So it's also important that it's okay and it's valid to ask your doctor or your psychiatrist to address your low hormone levels as part of your overall treatment approach. It takes me back to looking at the symptoms and managing and tracking your symptoms. The more evidence that you can come with, the better. To your doctor, I think it really makes a difference. So just to touch on taking medication for both ADHD and HRT, I guess we've kind of touched on it already. It's just essential that you find a treatment regimen that's tailored to you. And this might take time. And I know that can be really difficult when you're feeling really, really low, but at least once you start, you're on the right path. So you will need to work really well with your doctor and your psychiatrist to find the right balance of medications. And often you'll do shared care, but the only person that can change your level of ADHD medications is the psychiatrist, and then your doctor can work on your HRT. Again, tracking your symptoms is going to be really important in all of this. So use that page that I've sent out. I might try and build some sort of tracker, that symptom tracker with regards to the ADHD and menopause, that might help people. I know that would have helped me massively. And your GP going forward may prescribe, as I said, the medication under shared care as an arrangement with your ADHD specialist, but it is only your ADHD specialist that can change the medication. So it could take up to 6 months of titration until you're on the right level for ADHD. And HRT takes a number of months, 3 to 4 months at least, to fully kick in and to feel the benefits of. So know that going into this could take a little bit of time. I guess if you're not already using medication to treat your ADHD, the introduction of estrogen and perhaps testosterone could be it could well be enough to manage your ADHD symptoms and improve any other symptoms of perimenopause and menopause that you're experiencing too. So I know that some clinics will say that it might be best to treat your HRT first, because that might be enough to manage your ADHD symptoms. But it's totally up to you to keep an eye on it to see how you are feeling and how that's all working. So I hope you found that really helpful. As always, please get in touch, talk to me, let me know if that helped at all. I'm trying to keep it to around the half an hour mark, and I think we're just about there. I suppose finally, just anybody looking to follow and keep up to date, please I'm on Orla Holland. It's just an open Facebook page, or orlaholland.adhd on Instagram, and Orla Holland on TikTok. I think it's under Adulting is Hard. And I will do this podcast weekly. Please do share it. I'm trying to get it out to as many people as possible. This is really, really important information for our female friends to learn about. And I'm always at the other end of DM if you want to send me a message or get in touch in any way. I love the messages that I'm getting from all of you. I absolutely love hearing from you. And I really, really appreciate you listening to this podcast. Sometimes I'm shocked that people listen at all, but I hope you're finding it useful and helpful, and I'm thoroughly enjoying doing it. And once again, thank you so much for listening. Bye.